So you've been told you have high blood pressure, and now you're wondering why high blood pressure is a problem and what you can do to naturally reduce your blood pressure. Well, here's all the info you need on how to control your blood pressure. Welcome to the Health How To channel, where we talk about some great life hacks and easy tips to achieve better health. Please subscribe and share how you manage your blood pressure so that we can all benefit in our own personal journey to better health. Managing blood pressure is important for several reasons because it has significant impact on your overall health and well-being. Blood pressure refers to the force of blood pushing against the walls of your arteries as your heart pumps it through your body. It's typically measured in millimeters of mercury, mmHg, and is recorded as two numbers: systolic pressure, the higher number, and diastolic pressure, the lower number. Normal blood pressure levels can vary depending on age and individual circumstances. Generally, a healthy blood pressure reading is around 120/80 mmHg. However, it's essential to consult with a healthcare professional to determine your specific target blood pressure and create a management plan tailored to your needs. Here are 8 key reasons why managing blood pressure is crucial. Number 1, cardiovascular health. High blood pressure, also known as hypertension, is a major risk factor for heart disease and stroke. When your blood pressure is consistently high, it can damage the arteries and lead to hardening of your blood vessels, which increases the risk of heart attacks and strokes. Number 2, kidney function. The kidneys play a crucial role in regulating blood pressure. High blood pressure can damage the small blood vessels in the kidneys, reducing their ability to filter the waste out of your blood. Over time, this can lead to kidney disease or even kidney failure. Number 3, brain health. Uncontrolled hypertension can damage the way you think, known as cognitive decline and vascular dementia. Additionally, it can lead to an increased risk of bleeding in the brain, which can cause a stroke. Number 4, eye health. High blood pressure can damage the blood vessels in the eyes, leading to vision problems and an increased risk of retinopathy, which is a condition that affects the retina. Risk of aneurysms. Persistent high blood pressure can weaken the walls of arteries, making them more susceptible to forming a bulge in the blood vessel, known as an aneurysm. Aneurysms are potentially life-threatening as they can rupture and cause severe internal bleeding. Number 6, heart health. Hypertension places extra strain on the heart. Over time, this can lead to heart muscle thickening and an increased risk of heart failure. Number 7, increased risk of other conditions. High blood pressure is often associated with other health problems such as diabetes and high cholesterol. When you have both these conditions, the risk of heart complications is even higher. Number 8, quality of life. Chronic high blood pressure can lead to symptoms like headaches, fatigue, shortness of breath, and chest pain, which can negatively impact your quality of life. Now that we know why high blood pressure is such a big deal, let's talk about what we can do to naturally reduce our blood pressure. We'll talk about what diet changes we can make, what exercises to do, and what lifestyle changes to make. Dietary changes. Diet plays a crucial role in managing and reducing high blood pressure. Making dietary changes can help lower your blood pressure and reduce the risk of cardiovascular complications. Here are some diet changes you can make to decrease high blood pressure. Number 1, reduce your salt intake. Limit high sodium foods like processed and packaged foods, canned soups, fast food, and salty snacks. Choose fresh, whole foods and cook at home to have more control over the salt you add to your meals. Use herbs, spices, and salt substitutes to season your food instead of salt. Number 2, increase potassium intake. Potassium helps counterbalance the effects of salt. Include potassium-rich foods like bananas, oranges, potatoes, sweet potatoes, spinach, and beans in your diet. Number 3, follow the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. This diet emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy. It's high in potassium, magnesium, and fiber, all of which support lower blood pressure. Number 4, limit saturated and trans fats. Reduce your intake of saturated fats found in red meat, full-fat dairy, and tropical oils like palm and coconut. Avoid trans fats found in many fried and processed foods. Number 5, choose healthy fats. Opt for foods rich in monounsaturated and polyunsaturated fats, such as avocados, nuts, seeds, and olive oil. Number 6, increase fiber. Eat high-fiber foods like leafy greens, whole grains, oats, legumes, fruits, and fibrous vegetables. Edible skins, like from cucumbers and potatoes, also contain a lot of fiber. Choose organic if you can to minimize pesticides. Fiber helps lower blood pressure and supports heart health. Number 7, moderate alcohol consumption. If you drink alcohol, do so in moderation. For women, this means up to 1 drink per day, and for men, up to 2 drinks per day. Number 8, monitor portion sizes. Be mindful of portion sizes to avoid overeating, which can contribute to obesity and high blood pressure. Number 9, cut back on added sugars. Limit sugary drinks like pop, sweets, and foods with added sugars, as excess sugar consumption may lead to weight gain and high blood pressure. Number 10, eat more fish. Fatty fish like salmon, mackerel, and trout are high in omega-3 fatty acids, which can help lower blood pressure. Number 11, reduce caffeine. Some people are sensitive to caffeine, which can temporarily raise blood pressure. Monitor your response and limit caffeine if necessary. Number 12, stay hydrated. Adequate hydration can help maintain healthy blood pressure levels. Drink plenty of water and avoid excessive caffeine or alcohol, as they can lead to dehydration. Number 13, track your diet. Keep a food diary to monitor your salt and nutrient intake. This can help you identify areas for improvement and track your progress. Number 14, work with a dietitian or nutritionist. If you have high blood pressure, consider consulting with a registered dietitian or nutritionist. They can create a personalized diet plan tailored to your needs and help you make sustainable changes. Remember that individual responses to dietary changes can vary, and it's advisable to work with a healthcare professional to develop a comprehensive plan for managing high blood pressure. Lifestyle modifications, including a heart-healthy diet, regular exercise, and stress management, are often recommended along with any prescribed medications for hypertension. Exercise. Exercise is an important component of managing and decreasing high blood pressure. Regular physical activity can help lower blood pressure and improve overall cardiovascular health. Here are the types of exercise that can be particularly effective in reducing high blood pressure. Number 1, aerobic exercise. Aerobic or cardiovascular exercises are some of the most effective for lowering blood pressure. These activities increase your heart rate and breathing. Examples include brisk walking. Walking is one of the most accessible and effective forms of aerobic exercise. Running or jogging. If you're able to take your fitness to the next level, try running or jogging to significantly improve cardiovascular health. Cycling. If your back, hips, or knees can't take the pounding from running, try biking, either outdoors or on a stationary bike. It's an excellent alternative way to get your heart rate up if you have joint pain. Swimming. Swimming is a low-impact, full-body exercise that is particularly beneficial for those with arthritis. Dancing. Dancing is not only fun, but also a great way to increase your heart rate. Aerobic classes. For those of you who love to socialize and are more motivated in group settings, consider group exercises like aerobics, Zumba, or spinning. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week, as recommended by health guidelines. You may find that 30 minutes of moderate cardio 5 days a week is the most doable. Strength training. Strength training, also known as resistance or weight training, can also help lower blood pressure. It involves using weights, resistance bands, or your body weight to build muscle strength. Muscle tissue burns more calories at rest, which can help with weight management. aim to include strength training exercises for all major muscle groups at least 2 days a week. Flexibility and stretching. Incorporating flexibility and stretching exercises can improve joint mobility and reduce the risk of injury. Activities like yoga and Pilates are excellent choices for enhancing flexibility and relaxation. Stretching can also help reduce stress, which is helpful for blood pressure management. Interval training. High-intensity interval training, HIIT, involves short bursts of very intense exercise followed by brief rest periods. Studies suggest that HIIT routines can provide the same exercise benefits within a shorter period of time. HIIT has been shown to be effective in improving cardiovascular fitness and managing blood pressure. Mind-body exercises. Mind-body exercises such as Tai Chi promote relaxation, balance, and improved blood flow, all of which can contribute to lower blood pressure. Low-impact activities. If you have joint issues or mobility limitations, low-impact activities like water aerobics, gentle yoga, and stationary cycling can be effective ways to exercise without putting excessive stress on the joints. Remember to consult with your healthcare provider before beginning a new exercise program, especially if you have underlying health conditions or are taking medication for high blood pressure. They can provide guidance on the most suitable types and intensity of exercise for your specific situation. When it comes to your long-term health, consistency is key. Regular exercise combined with a heart-healthy diet and other lifestyle changes can have a significant impact on reducing high blood pressure and overall cardiovascular health. Lifestyle changes. Lifestyle changes play a critical role in managing and decreasing high blood pressure. Adopting a heart-healthy lifestyle can help lower your blood pressure and reduce the risk of cardiovascular complications. Here are some lifestyle changes you can make to decrease high blood pressure. Number 1, maintain a healthy weight. Losing excess weight, if you are overweight or obese, can significantly lower blood pressure. Even a modest 10-pound weight loss can have a positive impact. Number 2, stress management. Chronic stress can contribute to high blood pressure. Practice stress reduction techniques like deep breathing, meditation, yoga, or progressive muscle relaxation. Engage in hobbies, spend time with loved ones, and prioritize self-care to reduce stress in your life. Check out our videos on how to manage stress and anxiety. Number 3, quit smoking. Smoking not only raises blood pressure, but also damages blood vessels and increases the risk of heart disease. Quitting smoking is one of the most significant steps you can take to improve your heart health. Get adequate sleep. Aim for 7 to 9 hours of quality sleep per night. Poor sleep can lead to higher blood pressure and other health issues. Watch our videos for tips if you have trouble sleeping. Monitor your blood pressure. Regularly measure and monitor your blood pressure at home or at a healthcare provider's office. By keeping track of your readings, you and your healthcare team can see how effective your lifestyle, diet, and exercise is. Medication adherence. If your healthcare provider prescribes medication to manage your blood pressure, take it as directed and follow up as recommended. Number 7, regular checkups. Schedule regular checkups with your healthcare provider to monitor your blood pressure and overall health. And number 8, connect with healthcare professionals. Collaborate with your healthcare team, including doctors, nurses, dietitians, and physiotherapists, to develop a personalized plan for managing hypertension. Remember that lifestyle changes can take time, and it's essential to be patient and consistent. Making these changes gradually and as part of a holistic approach can have a significant positive impact on your blood pressure and overall health. Always consult with your healthcare provider before making significant lifestyle changes, especially if you have underlying health conditions or are on medication. Is there anything else that you found has helped you manage your blood pressure? Let us know in the comments section. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.